Hello, my name is John Thurlow. I'm a physiotherapist working for Somerset NHS Foundation Trust. I'd like to talk about subacromial pain, explaining the condition, the symptoms you might experience, some suggestions on how you might ease these symptoms, as well as some basic exercises. There are many causes of shoulder pain, but the most common cause is related to the rotator cuff. These are a group of muscles and their tendons that work whenever we move our arm, and they can also keep the ball central in the socket of the joint. Sometimes due to overuse, a change in activity, or just normal age-related changes, these muscles don't do their job as well, and this can result in pain. The shoulder is formed from the shoulder blade or scapula, the upper arm bone called the humerus, and the collarbone or clavicle. There are 4 rotator cuff muscles that arise from the scapula and connect to the head of the humerus, forming a cuff around the glenohumeral joint. The rotator cuff tendons lie under the acromion, the uppermost part of the shoulder blade. It's common for people to tell us that they experience pain around the shoulder and upper arm, and that this pain is worsened by raising the arm or reaching behind your back. Quite often people tell us that it's painful to lie on the affected shoulder, and this might lead to disturbed sleep. The good news is that in most cases subacromial pain responds well to some simple exercises and advice. However, it does take patience, as it can take 6 to 12 weeks to see a significant improvement. You may find it helpful to take some pain medication to help manage the symptoms. We'd recommend that you discuss with your GP or pharmacist as to what medication may be best for you. Using an ice pack after activity or exercise can also help ease the pain. If your sleep is disturbed, try supporting your arm on a pillow, or place a pillow behind you to prevent you rolling onto your painful side. It's important to try and remain active, and, if you are able to engage in general exercise, such as brisk walking. Keeping active will stop your shoulder from stiffening up and encourage recovery. However, if an activity significantly worsens your pain, you may want to stop or reduce the activity until your shoulder starts to improve. When exercising, a small increase in pain is okay, as long as it settles back down within 30 minutes and is not worse the next day. If your pain does worsen, then don't worry, it's most likely to be a sign that you've done just a bit too much. Reduce the amount of exercise to a manageable level and gradually build back up again. Here are some suggested exercises. You don't have to do them all, and you can start off with just 2. You can introduce the other exercises once the first 2 you choose are easier. Begin with 6 to 8 repetitions of each exercise with a minute of rest in between, and try to gradually increase how much you do of each exercise. It's advised you try and do them about 5 days a week.
Wall slide. Find a smooth wall or door and a cloth that will slide easily on the wall. Stand facing the wall with one foot in front of the other. Place the little finger side of your hands against the wall with your thumbs pointing towards you. Gently slide your hands up the wall as far as you can, whilst keeping a firm pressure through your hands. Relax and return to start position. Wall press up. Standing facing a wall, place your hands on the wall in front of you. Make sure your hands are placed a little wider than the width of your shoulders and your hands are turned out slightly. Bend your elbows, taking your head towards the wall and keeping your body in a straight line. Straighten your arms, pushing yourself away from the wall and back to the starting position. To decrease the load, you can stand closer to the wall. You can increase the load by taking your feet further away from the wall. Table slide. Sitting at a table or standing at a kitchen worktop, place both hands on a towel placed on the surface. Bend at the hips and lean your upper body forward, sliding the hands away. Slowly return to the starting position, sliding your hands back whilst bringing your upper body upright. Forward lean. Stand facing a table or other solid surface. Place your hands on the table. Walk backwards and bend forwards at your hips. Return to the start position by walking forwards. Abduction, angel wings. Standing with both arms down by your sides and your palms facing forwards. Slowly take your arms away from your body, out to the side. Only take them as high as is acceptable for you and your symptoms. Slowly lower your arms back, down to your sides. Thoracic rotation. Sitting upright on a chair, fold your arms across your chest. Slowly turn your body and head around to one side. Return to the centre.
Please note, if the following applies to you, you have any of the following symptoms, it's advised you speak to a doctor or your physiotherapist first. You've had an injury to your shoulder that's caused weakness and or inability to raise your arm. You've noticed any unusual lump or swelling around your neck, shoulder or arm. You have warm red skin in the region of pain, have a fever or are feeling generally unwell since your shoulder pain started. You've had an injury to your shoulder that has led to your shoulder having a different appearance or shape. You have pain that is getting worse or not improving despite taking painkillers and doing the recommended exercises. Or your pain is so severe that it prevents you from doing the exercises at all. You're experiencing a loss of sensation or weakness in your arm or your hand. We hope you found this helpful. Your GP or physio can help you with any further advice or guidance. And we also recommend the NHS website. Thank you.